Today, I want to talk to us about eyelid contusions and lacerations. Eyelid injuries consist of contusions and laceration and usually caused by physical trauma. These eyelid contusions are more significant cosmetically than clinically. More serious injury may sometimes accompany them and should not be overlooked. Uncomplicated contusions are treated with ice packs to inhibit swelling during the first 24 to 48 hours. Severe blunt trauma to the periocular region can result in orbital hemorrhage and orbital compartment syndrome with the potential for loss of vision. It is imperative to check visual function and examine the globe in all eyelid injuries. If eyelid swelling is too extensive to allow examination of the globe, an ophthalmologist should be consulted urgently. So this is an example of eyelid laceration. So when you look on that upper part of the eyelid, there is a laceration. An eyelid cut are tear in the soft skin that covers the eyes and skin in the immediate surrounding area. Children are prone to getting laceration in this area. So as you see, that flap is a laceration of the upper eyelid. Eyelid lacerations are partial or whole defects in the eyelid that make up subset of the facial trauma. They may be accompanied by various ocular injuries, including orbital fractures, corneal abrasions, open globe, and lacrimal drain system disruption. So there are some risk factors that would contribute to these eyelid contusions and laceration. Some of the risk sporting activities may include football, wrestling, rugby, soccer, boxing, and hockey. And some of the intense jobs. So for instance, profession like lumberjacking, construction, carpentry, these are more prone to cause eyelid laceration, or professional athletes that have high risk of the same. Beauty product users. Some makeup and beauty products are sharp and require delicate handling. So for instance, ladies, when they're doing the makeup, there are certain objects that are very delicate. So with such, they require proper handling to prevent some of these injuries. And also people who get into fights. So this is a common way for someone to end up with eyelid damage, as what we are talking about, contusions or lacerations. So aside from trauma, eyelid lacerations and swelling may be the result of certain condition and disease. Sometimes these lacerations can come in when someone has things like conjunctivitis or a pink eye, when they have a sty, allergies, or grave disease. So this eyelid contusion and laceration, basically, they are treated largely depend on the extent of injury and how it has come about. So many cuts of the eyelid go away on their own. Others require minor treatment that involve cleaning and bandaging, but some that are serious may need to be stitched. Depending on the mechanism of a trauma, there may be injuries beyond the eyelid. Ensure that appropriate workout has been completed. Superficial laceration may mask a deeper laceration, foreign body, or a penetrating injury to the lacrimal drain system, or orbit or globe. So before laceration repair is done, you may need to perform a computer tomography CT of the brain orbits, and face should be obtained if there is any history of suggestive of penetrating injury or severe blunt trauma. If the laceration is medial to the punctum, perform a punctal dilation and probing with irrigation of the canalicular system to assess the canalicular involvement. That is what I wanted us to discuss or to share about eyelid contusion and laceration.